Hi, this is Marcia Sorter. This little video is for students in the APTR program in Positioning 1, Positioning 2, and Rad 2. We're going to talk about PACEMan today, not to be confused with PACMan. PACEMan is a technique for radiographers to use to determine if a plain film radiograph is of diagnostic quality. This is a question that comes up every time an image is performed. PACEMan was devised in the 1980s by Roger Wendell in Adelaide, South Australia, to help other radiographers and students have a structured way in which to critique radiographic images. Now, at the time, Pac-Man video games were the rage, and it just so happened that the first letters of the areas that were identified as important to image critique made up the acronym PACEMan. And it has been widely used since that time by radiographers and radiologists. PACEMan is an acronym used to remember the following. P is for position, A is for area, C is for collimation, E is for exposure, M is for markers, A is for aesthetics, and N is for name. Okay, let's look at these in a little more detail. So when a radiograph is being taken, the radiographer needs to ask certain questions. P is for position. Ask the question, is the patient in the correct position? Is the patient rotated or tilted? Does the image correctly show all needed anatomy and bony detail? A for area. Is all of the area imaged being covered? For instance, in an abdominal image, does the image cover from the pubic symphysis to the diaphragm? Or have you exposed an area that does not belong on the radiograph? C for collimation. Is the image properly collimated? For instance, can you see four-way collimation on the image? E is for exposure. Were the exposure factors set correctly? Does the image show correct contrast and density? Are there any factors that need to be changed to produce a better image? Markers. Okay, have markers been placed on the image? Are they correctly identifying left and right sides of the patient on the image? A for aesthetics. Is the image nice to look at? Is the part centered to the image receptor? Can you see four-way collimation? And N for name. Does the image correctly identify the patient? And is there any other relevant identification details on the image? For instance, episode number, department labels, hospital, clinic, to identify this image. Okay, let's try a critique on a lateral skull image. Okay, we'll start with P for position. Okay, this is a right lateral skull. Or I'm assuming this is a right lateral skull because there are no markers on it, but it is hung like a right lateral skull. Okay, let's look at it and do some image evaluations. Okay, in a lateral skull, the orbital roofs should be superimposed upon each other, and they are. They almost create one line here, which indicates that there is no rotation or tilt because of this alignment. The sella turcica is in profile. You can see the anterior clinoid process and the posterior clinoid process and the dorsum sella and the sphenoid sinus. The mandibular rami are superimposed and the temporal mandibular joints are superimposed. And we see the mastoid regions. We can see, okay, then we need to see if the area is all seen. We can see the entire cranium We can see the frontal area, we can see the superior cranium, the posterior cranium, and the inferior cranium. It's all included. So all pertinent anatomy is seen on this. Collimation. The collimation looks correct. There is no extra anatomy included on it. We're using a 10 by 12 inch image receptor crosswise, so it can include the frontal area and the occipital area of the cranium. What about exposure factors? They look good too. The image is not underexposed, nor is it overexposed. So we have used a correct KVP and mass so that the contrast and density is good for visualization of bony detail. We can see the trabecular patterns in the skull image. Okay, markers. No, there are no markers seen on this image. There's no right marker, there's no left marker. There are no markers seen. Aesthetics. There is evidence of four-way collimation. The part is centered to the IR, and the image is pleasing to the eye. It's not overwhelming, it's not too dark, it's not too light. And as far as demographics or name of the patient, there are no demographics seen on this image. So we found some things incorrect with this image that would probably need to be taken care of. Every time a radiographic image is performed, the technologist should go through the PACEMan technique to determine the diagnostic quality of the image. If this technique is performed consistently, there will be fewer repeat images, and the patient is assured the best quality of imaging for diagnosis and radiation protection. Remember PACEMan when you critique an image. What about this right lateral skull? Should it be repeated? This is your homework. Thank you.